A common question when purchasing donor sperm is, what preparation type do I purchase? Sperm banks offer several options. You're going to see IUI, ICI, ART, and IVF. I'm going to take a few minutes to explain what these acronyms mean and how you can use them. An IUI is an intrauterine insemination. ICI is intracervical insemination. And ART is assisted reproductive techniques or technologies. IVF, of course, is in vitro fertilization, and another acronym that may come up is ICSI. This is intracytoplasmic sperm injection. Now, what you end up purchasing is going to depend on two things. It's going to depend on, one, what procedure you're having, and two, what's available from your chosen donor. If you're having an in-office IUI with a medical provider at your clinic, this is a procedure in which a catheter is used with a syringe to pull up the donor sperm sample. The syringe is inserted into the vagina. The catheter will go through the cervix into the uterus and deposit the sample directly in the uterus. This requires that the seminal fluid is removed from the donor sperm sample. So your best bet is to purchase an IUI pre-washed vial. These vials are ready to go. They get shipped to your office, to the clinic, or to your medical provider's office. They can thaw them, do a quick evaluation, and use them right away for the procedure. If your donor doesn't have IUI preparation available, you can purchase an ICI vial. These samples do not have the seminal fluid removed, so your clinic or medical provider would have to let you know if they have the ability to do a wash. If they do, great, you can purchase the ICI vial. You can also combine two IVF or ART vials for an IUI procedure in office. Second option, if you're doing a home insemination or an ICI, intracervical insemination. This is where you'll use a needleless syringe to pull up the donor sperm sample, insert into the vagina, and deposit the sperm sample directly onto the cervix. For an ICI, you can purchase an ICI vial. You don't need to wash that seminal fluid away, so those samples are ready to go for an ICI. If there are no ICI vials available, you can use an IUI vial. It too is ready to go for an at-home insemination. You could also combine two ART vials or two IVF vials. If you are working with a medical provider to use assisted reproductive technology to achieve a pregnancy, you can use any of the preparation types. Most banks will offer an ART or IVF preparation at a lower cost. These vials often have fewer total motile sperm available, but that's because it takes far fewer sperm to achieve fertilization. So again, quick summary. IUI in office with a medical provider. Your first choice, go for an IUI vial. They're ready to go. You can use ICI if IUI is not available, or combine two ART prep types. If you're having an at-home insemination or an ICI, you can choose the ICI prep type. If that's not available, you can use an IUI, or you can combine two ART or IVFs. If you're having ART completed by a medical professional, you can use any available vial, but you might want to try to purchase an ART or an IVF vial because they are a bit lower cost. Hopefully that answered your questions.